time for our complete ethics and law review for USMLE and COMLEX. In this video, we're going to learn about tattooed DNRs, performing mastectomy on the wrong patient, HIPAA violations, and more. So let's begin. Our first question, living will versus crying spouse. Who wins, the living will or the crying spouse? And of course, we know the answer is the living will. A living will overrides the wishes of any family member, even crying ones. Question 2. The living will says, I never want dialysis. And the friend says,
I know him. Trust me, he wants dialysis.
Who wins, the living will or the friend? And the answer again is the living will, because a living will overrides the wishes of any family member or friend, even if they use incredibly convincing language, using words such as trust me. Question 3. A lady is arrested for trying to use fake money, a $1 million bill at Walmart. This is a true story, by the way, and has actually happened several times in history. She's arrested. She screams, "That's not justice!" Is she right? Yes, because justice means equal treatment. So she does not deserve to be arrested just like every other citizen. Or no, justice means fair treatment. And the answer is no, because the definition of justice is fair treatment. Not equal treatment, but fair treatment. Generally, we assume that all people should have equal treatment, but not when people act illegally. As Aristotle said, treat equals like equals and unequals like unequals. Question 4. What is the more effective way to express one's desire to be DNR? Print out and sign an online form? Or to tattoo DNR to one's chest? And the answer is to print out and sign an online form and give it to your doctor, who will sign it as well, along with 2 witnesses or a notary. Because regardless of trends, tattoos are not legal documents. It's the document which is binding. And by the way, this is actually relevant, because there have been cases in history where people tattooed the letters DNR to their chest, not knowing what it meant, because they lost a poker bet. And then they came to the hospital, and the physicians let them die. Question 5. A nice 23-year-old lady visits her great-great-great-grandma in Brazil, and now she has 4 weeks of fever, night sweats, and weight loss. What is the most appropriate next step? To test her now, isolate later? Or to isolate now and test later? Or to vigorously rub vinegar all over the lady's body? The reason why I mention this choice over here is because that used to be the treatment for TB. In the 1800s, they would vigorously rub vinegar all over a person's body if they had TB. This was called a vinegar massage. And interestingly, is not rooted in complete stupidity. But anyway, it's not the answer over here. What's the answer here? Isolate now, test later. It is completely ethical to isolate a patient based on suspicion alone. For as the CDC says, persons who have or are suspected of having infectious TB should be quarantined and isolated. And just in case you're interested, here's a little bit about the history of treatment for TB. Question 6. Smiley 7-year-old boy with Asian mommy walks into office. The doctor says, "What are those lesions on your son's back?" Mom, with an Asian accent, says, "I squeeze cups on son's back, China." The son chuckles. What's the next step? Should you say, "Oh, that's very interesting," or get a CBC, or call Child Protective Services? Well, these lesions look pretty bad. But still, the answer is you should respond, "Oh, that's very interesting." And the reason is because cupping is an ancient form of alternative medicine from China, in which the therapist uses special cups on the back skin to create a suction. A similar mechanism is coining. These practices can be painful but aren't dangerous, and therefore patients should not even be discouraged from performing these practices, and you should definitely not report them for child abuse. Question 7. A 67-year-old female cocaine addict with a 2-centimeter midline shift subarachnoid hemorrhage is now dying. Her mother, worried, storms in holding a document stating that her daughter wants ventilation. What should the physician do? Ventilate because of the document, or not ventilate because it is futile? And the answer is not ventilate because it is futile. This lady is dying. Ventilation won't accomplish anything. Advanced directives may be strong, but they can't bring a person back to life. And that's the concept of futility. A futile treatment refers to one that has no benefit, and physicians have no obligation to administer futile treatment even in the face of an advanced directive or a screaming family. Question 8. Can a parent refuse MMR and Tdap vaccines on behalf of their delicious, sweet, innocent, and naive child? And the answer is absolutely yes. Parents have the legal right to refuse vaccinations for their children because doing so is not considered a serious, immediate threat. But in the world of medicine, of course, we consider this negligent. and the physician should try to understand their position and help them make the better decision. Question 9. A 58-year-old man is angry about his circumcision. He wants to sue his parents. He will most definitely lose the case because the parents upheld which of the following? Beneficence, justice, or proportionality? And the answer is beneficence. That is, the parents made a reasonable decision on the child's behalf that is not negligent and in fact has many positive medical benefits for the child. So circumcision is not illegal, it is completely ethical. So although this 58-year-old man over here is angry, he's wasting his time. Question 10. EMTLA requires that a hospital manage care of a patient until the patient is stable or healthy. And the answer is stable. Emergency rooms do not need to wait until the patient is totally healthy, they just need to make sure that the patient is stable. And if you have trouble remembering the 3 components of EMTLA, I have that over here. M is for
Screen me, please.
screening. Ta is for
Talk to me and make sure I'm stable.
and La is for
Ladies and gentlemen, I'm out of here.
because those are the 3 components of EMTLA. Screening, making sure the patient is stable, and transferring them out once they're stable. 11. While checking your patient's blood pressure, she cuts the cheese at 194 decibels. That's actually the world record, by the way. And just for reference, a rocket is 180 decibels. She looks very embarrassed. What do you say? I didn't hear anything. That reminds me of the Swiss cheese model. This is something all my patients do. I apologize. That was me. Or, I understand you are embarrassed, but I just want you to know that you don't need to be. And the answer, of course, is D. And the point that I'm trying to highlight over here is that physicians should not lie just to make their patients feel good. They need to express veracity and transparency. Another example would be, your cystic kidneys aren't such a big deal. No, cystic kidneys could be a very big deal, and therefore don't mislead and misguide your patients. Transparency is the key to a good physician-patient relationship. 12. Mom says,
My son has Down syndrome. This is all my fault. I shouldn't have snorted cocaine during my pregnancy.
what should you respond? You could read these choices over here. I like choice number C. I didn't know you snort coke. Can I have some? Nah, that's not the right answer. The answer is D. Your son's condition is not your fault. A patient who incorrectly self-blames should be reassured right away, without delving into their understanding of the situation. It's true that cocaine during pregnancy can lead to awful outcomes, such as placental abruption, but in this case, it wasn't her fault. Cocaine has nothing to do with Down syndrome. Question 13. There's an aggressive and agitated woman in the ED. Security is nearby. The patient has not been shown to be violent, at least yet. What's the next step? Tell the patient that there's an elephant behind her. When she turns back, run away. B. Run for dear life. Let security take over. C. Pretend you are a lizard. See if she believes you, as a form of psychiatric assessment. Offer her a yummy cookie. And the answer is, offer her a yummy cookie. When dealing with agitated patients that have not yet been shown to be violent, be nice. Doing other things could cause the situation to escalate. If violence is imminent, physical restraints, IM antipsychotics, or lorazepam may be used. Question 14. A 60-year-old male smoker who has a 15-pack-year history says the following. I demand the following: a lung cancer screening, a DEXA scan, and a colonoscopy. And his last one was 7 years ago. Ordering these tests would be overuse or overdiagnosis. And the answer is overuse. Lung cancer screening is not yet. For that, you need a 20-pack-year history and be 50 years old. DEXA scan, that's for ladies. For men, there's unclear data. And colonoscopy, that's every 10 years, and he already had one 7 years ago. So that would be considered overuse, i.e. misuse. They're synonymous. Overdiagnosis is, for example, telling a 114-year-old lady that she has a slow-growing carcinoid tumor. That's overdiagnosis because she's obviously going to die before the tumor has any significant effect on her health. Question 15. The patient is terminally ill in the ED, unconscious. The physician wants to withdraw care. The family is furious, and the ethics committee can't reach a conclusion. What should the physician do? Call the judge or withdraw care? And the answer is, call the judge. Because if the ethics committee cannot reach a conclusion, the next step would be to get a court order, i.e. call the judge. 16. Can a psychiatrist, male, terminate the patient, female, from his practice so that he can marry her? No. In general, a physician must terminate the patient-physician relationship before initiating a dating, romantic, or sexual relationship. The exception is psychiatry, We are concerned that a psychiatrist can take severe advantage of the patient. According to some, the psychiatrist must wait 2 years before marrying the patient, and according to others, he may never marry the patient. Question 17. 2 physicians perform a brain death exam and declare the patient brain dead. What's the next step? Notify the ethics committee or pull the plug? And the answer is pull the plug. 2 physicians declaring brain death is equal to death, and you don't need to tell the ethics committee that you are killing a dead person. Question 18. A 22-year-old lady says,
Doctor, my husband rapes me.
On PE, she is clearly abused. What should you say next? Marital rape is not illegal? That is very difficult for me to hear. Are you safe to go home, or do you have a safety plan? And the answer is, that is very difficult for me to hear. Because the first step when it comes to intimate partner violence is to show empathy. Only afterwards do we start thinking about assessing whether or not there's immediate harm and coming up with a safety plan. Now, in terms of marital rape, in all 50 states of the US, marital rape is of course considered rape and illegal, and you can go to jail for it. Only in the Arab countries is spousal rape not considered abuse. Question 19. What does this billboard promote? Defensive medicine or beneficence? And the answer is, these lawyers over here who spend all of their time suing doctors promote a terrible thing called defensive medicine. That's the distorted practice of medicine to avoid being sued. And there's an estimated $50 to $200 billion annually spent on defensive medicine because of these guys over here. These guys cause doctors to engage in positive defensive medicine, i.e. ordering extra unnecessary testing for fear of being sued, or negative defensive medicine, declining to perform increased risk procedures because, again, they're scared of being sued. So injury defense lawyers, you're costing the country a lot of money. Question 20. Physicians can be best protected from liability while at the same time optimize patient care via clinical pathways. As we mentioned, defensive medicine is distorted practice and can cause a doctor to get in trouble, but clinical pathways create a consistent workflow for healthcare delivery. And I give an example over here. Question 21. A 23-year-old lady has explosive diarrhea. Anti-transglutaminase comes back positive, as well as IgA deficiency, i.e. she has celiac. At least you strongly suspect it. You order a duodenal biopsy to confirm the diagnosis, which is in 3 weeks, and you tell your patient,
Enjoy a slice of bread every single day.
You displayed an act of, and the answer is beneficence. You did not do harm, and this case over here is an example of a medical question kind of couched into an ethical question. It's not really an ethics question, it's a medical question, and that is that it is essential to eat some gluten every day, for example a slice of bread, before a duodenal biopsy, otherwise the test can come back false negative. And therefore this is beneficence because this is necessary for the diagnosis, so even though there may be some discomfort involved, i.e. she may have diarrhea during those 3 weeks, because of your request. 22. Can OBGYNs prescribe benzos and SSRIs? And the answer is absolutely yes. OBGYNs and PCPs can prescribe these medications, but they usually only do it on a temporary basis and require the patient to follow up with a psychiatrist. 23. Doctor tells mom that her daughter Dahlia has Stoneman's disease. Look up Stoneman's disease on Wikipedia. It's quite fascinating. But anyway, mom says,
I don't think I should tell her. It will crush her.
What should the doctor respond? And the answer is, knowing her diagnosis will be to her benefit, so let's come up with a plan to tell her. And that is that children, especially older ones, should be informed of their diagnoses in general. So if a parent feels like it might be too much, a disclosure plan should be discussed. 24. An 8-year-old girl with capacity is brought in the ED after a car accident. She requires splenectomy but refuses it. Contrary to her parents' wishes and contrary to her proxy, she knows she will die without the surgery. What's the next step? And the answer is, of course, no splenectomy even though she will die. Because a conscious and competent patient's wishes override just about anything. Family proxy, and the patient's own previously stated or written wishes. What the person says right now is what matters most. Question 25. You accidentally perform a mastectomy on the wrong patient. After getting sued, you are inspired to research how to eliminate this type of error from existence with less than a 0.0001% annual incidence. What type of methodology should you use? And the answer is 6 sigma. 6 sigma is the reduction of an error by 6 standard deviations. This is not a lean. A lean is identifying and reducing waste, which was discovered by people involved in studying the Toyota company. And Swiss cheese, this is a conceptual model involving multiple layers of defenses that can be penetrated by an accident or mistake, resulting in an undesired outcome. 26. 22-year-old woman getting ready for labor.
Doctor, I'm in the mood to get bloody. I insist on a C-section.
Patient is fully competent. You aren't comfortable with performing the C-section. So what's the next step? To perform a C-section against her wishes, or to refer the patient to another OBGYN? And the answer is refer the patient to another OBGYN, because a physician is not ethically bound to perform a procedure that he doesn't want to do, and in such a case, he should refer to another physician. And in this case, one who doesn't mind accommodating for this woman's desire for some nice red, juicy blood. 27. Who will most likely get in trouble? You could read these choices over here, and the answer is an attending using a defibrillator on a DNR patient, because DNR means you can't use CPR, defibrillator, or pressors, i.e. you can't bring a patient who's dying back to life. But DNI only involves tubes in the throat, and in terms of a secretary performing a CPR on a DNR patient, technically, and DNIs only apply to healthcare workers. They may not even apply to the paramedics on their way to the hospital. 28. A 34-year-old woman is happy with the benzos you prescribed her. She presents you with a delicious cake as an appreciation token. What factor is most, important when deciding whether to accept it? And the answer is her motivation. In general, expensive gifts should not be accepted, but for small ones, it depends on the motivation. If she's trying to influence you, don't accept it. 29. Homeless man A is about to be ventilated. Homeless man B says, "Hey, John wouldn't have wanted them tubes." There are no documents or family members. Why should we listen to homeless man B? And the answer is substituted judgment. Substituted judgment means deciding what he would have wanted, and this is the job of the surrogate to ascertain. And in this case, the friend is the surrogate. 30. HIV/AIDS patient repeatedly refuses to disclose his HIV status to the partner, who is in the waiting room. What's the next step? And the answer is to tell the partner. You have a legal duty to tell the partner, and that's because the partner's safety overrides the patient's right to confidentiality. And there's another option that you could have gone with, to notify the health department, and they would notify the partner. 31. A 20-year-old wants her tubes tied, understanding the risks involved. What is the proper response? I'm sorry, 20 is too young. It is not ethical. Or, okay, let's schedule a ligation. Because again, it is completely ethical to perform sterilization on a woman who desires sterilization and understands the risks. Although at 20, it probably won't be covered by insurance. 32. Treating an unemancipated minor requires informed consent from one parent. If one parent agrees to the procedure and one does not, proceed with the procedure. Minors do not have capacity. Emancipated minors, by the way, would include someone like in the army, or one who had a baby who got married, or is homeless. In that case, you would not need parental consent. 33. An 18-year-old is unconscious after a motorcycle accident. He's about to be intubated when he wakes up for a brief moment and screams, "No, hey, get that stuff away from me!" And then he passes out. Why should you proceed with intubation? And the answer is because informed refusal was never given. Informed refusal requires that the patient is aware of the consequences of his or her decision, and we cannot be sure that this is what's going on over here, because he just woke up for a few seconds and then passed out, and the risks were never explained to him. 34. A 5-year-old boy, crying in extreme pain, is brought in by his uncle. Uncle said,
"He fell off them monkey bars at school."
PE reveals a diminished right radial pulse, and x-rays show a right supracondylar fracture. The doctor says,
Where are his parents?"
Uncle says, "Oh, they're on vacation, some submarine trip." What's the next step? To treat the boy without consent? To call Child Protective Services, or delay treatment until parents can be contacted? And the answer is to treat the boy without consent. There is no reason to assume over here that there's child abuse, because it's very normal for a child to have a supracondylar fracture with diminished pulses. And waiting to speak with the parents in this situation could cause detrimental, permanent delays. Detrimental, permanent effects, so therefore, treat the boy without consent. 35. An 11-year-old unvaccinated girl with sickle cell is brought in by her parents because they caught her sneaking candy into the house against the family rules, and they want a psychological evaluation for ODD. Oppositional defiant disorder. After discussing the incident, the doctor discovers that the parents, haven't been giving her medications for sickle cell. They respond,
"We've told our last doctor those meds are even worse than candy."
We would never feed that garbage to her. Next step? The answer is obtain a court order. We don't respect their wishes, we get a court order because this girl over here requires sickle cell treatment. Not for immediate life, but these medications are still required for her, and if she doesn't have them, she could die, and therefore we need to get a court order to force the parents to provide her with her medications, or the child will be taken away from them. 36. A 15-year-old girl tells her psychiatrist that she is involved in deliberate self-injury, for example, wrist cutting, without intention to kill herself. What should the physician do? Create a plan together to tell her parents, because minor confidentiality doesn't apply to dangerous behaviors, even if they don't involve direct suicide. But directly telling the family would lose the patient's trust. But if this girl over here did not consent to tell her parents, it would be the psychiatrist's duty to tell the parent. 37. A surgeon asks the nurse to call a child's mother the night before a procedure for consent. What is something he did wrong? And the answer is, he should have obtained the consent himself, because doctors need to get the consent themselves. A nurse can't do it, a partner can't do it, the doctor himself, who's performing the surgery, needs to get the consent. 38. A 31-year-old woman requires intubation. Which of the following may be a reason to withhold intubation? And the answer is metastatic cancer. Because again, as we spoke about, futility. But severe developmental disability is not a reason to withhold proper treatment. 39. What should a doctor tell his 16-year-old female patient when she asks,
So you won't tell my parents anything we speak about?
And the answer is, our conversations are private unless there is a safety issue. I.e., you do have to inform her that there are situations where you will break the confidentiality. Don't say that everything we speak about will be confidential, because again, there are exceptions. 40. A 1-week-old requires intubation or else he will die. Mom says, no way, Jose. We don't do tubes where I come from. What's the next step? Intubate the patient. Parents cannot make decisions on behalf of their children that will kill them. 41. A patient develops myocarditis from a COVID-19 vaccine and dies. The patient's father files a lawsuit against the physician since my son was never informed of this side effect. Who will win? And the answer is the physician, because this wasn't malpractice. There was no deviation in standard of care. A physician should discuss risks and benefits of treatments, but this doesn't include every potential rare side effect. 42. Black patients are less likely to be prescribed pain medication. This is primarily due to implicit bias, that people think that black patients have greater pain tolerance, thicker skin, and feel less pain than white patients. Explicit bias would be outright racism. That's not what we're referring to over here. We're talking about unconscious conclusions that are made, cognitive biases which are implicit. 43. A surgeon attending notices every single flaw in his naive third-year medical students. He probably also displays all of the following. Bias blind spot, and you could take a look at these biases seen in arrogant people. 44. Physician is walking in the parking lot. A lady approaches and says,
Doctor, you have been seeing Sarah, my sister. I have some very concerning things to share with you about her.
The physician should say, let's talk private. He can't say these other things over here, and you could take a look at what, and you could see why. But I wrote on the bottom that physicians may hear information relevant to patient care if they listen passively and don't share any patient information, because that, of course, would be a breach in HIPAA. 45. A man in a car accident is brought to the ED. Unconscious, low blood pressure. A blood transfusion is started. The wife runs in and says,
He wouldn't want this. Transfusions are against our religion.
What's the next step? And the answer is to discontinue the blood transfusion. Since there's no advance directive over here, the surrogate is trusted to make decisions on the patient's behalf. But of course, other non-transfusion related therapies should be taken to care for the patient. A patient has headaches. You realize it is a malignancy. What's the first thing you should say? I'm sorry, but this might be cancer. Or B, what is your understanding regarding the cause of your headaches? Because in Spikes, for breaking bad news, S is for setting up the consultation, not over the phone, and P is for perception, assessing the patient's perception of the situation. 47. Patient is very angry and verbally abusive. You lowlife idiot, I'm going to report you. The doctor should say, can I ask what is making you upset, as I want to help you? Not, I understand, let me refer you to another doctor. The point is to always start off with open-ended dialogue question. That could help settle down angry patient. 48. The default surrogate decision maker is first the spouse, then of course, the children. They come before the parents. Spouse, then children, then parents, then sibling, then friend. 49. When dismissing a difficult, for example, a deceptive, lying patient from the practice, which of the following should be done? And the answer is notify the patient in writing of the termination. You don't need to find a specific provider before notifying the patient, because that assumes you know what's best for him. He could decide that on his own. But at least have the termination in writing. 50. Initial response to the patient suggesting alternative medicine is, tell me more about your interests. 51. What is an effective way to reduce the likelihood that a patient will request unnecessary imaging, for example, for leg pain? And the answer is by performing a beautiful physical exam. When the patient sees that the doctor is performing a thorough and detailed physical exam, pointing out structures as he goes along, that will alleviate their concerns, and they're less likely to ask for extra imaging. 52. A patient insists on using glucosamine for arthritis of the knee. The doctor should respond, not that glucosamine is not FDA approved, but let me share some resources with you. Because glucosamine, in some studies, has actually been shown to be helpful. It's not FDA approved, but in this situation, the patient is clearly interested, and so you should provide resources. 53. Cross-cultural care emphasizes the importance of aligning care with patient values, beliefs, and the answer is avoiding stereotypical conclusion. Cross-cultural care does not involve language. It involves avoiding stereotypical conclusions and to understand patient beliefs and values. That's what cross-cultural care is all about. 54. Medical teams are most successful when they ensure that all members share a common goal. Kind of like a marriage. As long as the husband and wife share a common goal, that's what's going to make the marriage extremely successful, even if there are problems. The husband and wife may not have equal participation. He may have one job and she may have another, and they don't always avoid criticism. What makes them great is that they share a common goal. For example, to build a beautiful family together. So that's what and in our case, that's what also makes medical teams most successful. 55. An effective way to improve patient compliance with a medication regimen is prescribe a fixed drug combination. For example, Augmentin. That's better than having amoxicillin clavulanate separate. And for example, once-a-day dosing, as well as follow-up appointment. And another one would be seeing the same provider for most visits. 56. Patient says,
"Won't hospice make me die sooner than I should?"
The physician should respond, hospice allows patients to die naturally, not sooner. But hospice does not allow for life-prolonging measures. And we write that over here. 57. Patient says, 58. A woman with cancer who wants to enroll in hospice may be asked to discontinue her, which medication? Alendronate and statin. Because these are not palliative, these are for long-term therapy. Hospice allows for palliative treatments, but not for medications intended to cure or control disease. 59. What should an OB/GYN consider before prescribing her 90-year-old patient a medication? And the answer is, it may be preferable to call the PCP and have him prescribe the medication instead, because it's better, because that reduces problems. For example, due to lack of optimal communication, it's better to have the PCP order the medication, especially in older patients. 60. A doctor is working on an order for patient A. The nurse says,
"Doctor, can you clarify medication for patient B?"
Doctor should answer the nurse? No, to ask the nurse to wait. When you're working on one task, finish it before going on to task B. 61. This organization brings groups of providers, for example, physicians, pharmacists, and facilities together, and via coordination they improve care and reduce costs. This is an accountable care organization. It's just a larger version of a patient-centered medical home. Some refer to the accountable care organization as the neighborhood, and the patient-centered medical home as the home, i.e. a smaller version of it. 62. A 50-year-old woman with weight loss and a positive FOBT is told that a colonoscopy is recommended. She exclaims,
"Why? A colonoscopy? Doesn't that check for cancer? What are you saying, Doc?"
The doctor should respond, "It may or may not be serious, that's why we should get the colonoscopy." He shouldn't say, "It's probably not cancer," because that falsely gives off the impression that it's probably totally fine. 63. A hospital or physician is given a financial incentive to meet a performance objective. Is this illegal or fantastic? And the answer is, this is fantastic. Pay for performance is fantastic. It's no different than a boss giving his employee a raise for good performance. So again, this is fantastic, not illegal. 64. The lady says, "Doctor, I just keep on getting fatter and nothing is working." The doctor should say, "I believe in you, you can do it." Or B, and that's the right answer, "Let's sit down and talk about a goal for you to achieve by next month." Saying "I believe in you, you can do it" is worthless because it doesn't set any concrete goals for the lady. And that's why I wrote, the fluffy answer isn't always the right one. You want to be SMART, specific, measurable, attainable, relevant, and time-bound. That's what will be efficient for the patient. 65. Patient's not ready to stop smoking and says,
"I'm just gonna relapse and be a total disappointment."
The doctor should respond, most smokers who try to quit are eventually successful. It just takes time. And the point is to be encouraging. For example, by reassuring them that it's possible, and that's actually a very effective way to reassure them. 66. A borderline personality disorder patient screams at her doctor and then is nice to him, and then screams at him and then screams at the nurse and then is nice again and then gives an evil smile to the PA and says, "I hate you." What's the next step? And the answer is, let me gather my whole team so we can together discuss a treatment plan. Because that's what you have to do with borderline personality disorder patients to avoid splitting, is that you approach them together as a team, and that can be helpful in managing them and avoiding the splitting. 67. Lady insists, "I do not want to know the test results, doc." The physician should respond, "May I call your husband or another family member to discuss the diagnosis?" And the reason is, we want her to be able to know the diagnosis. We want that if she changes her mind, she has someone to ask. Now, I wrote another reasonable option on the bottom over here. You could take a look. 68. Question 68. Any pregnant woman with capacity may refuse a C-section in the U.S., even if vaginal delivery is dangerous to the fetus, due to the principle of autonomy, and that is true. A pregnant woman has ultimate rights to her baby until it's born, and the same would apply, by the way, even if the vaginal delivery might kill mom and the baby. She has a right to make a decision that might kill her and her baby. 69. Daughter said,
"I don't know if my dad would want to withdraw care at this time."
The physician should respond, let's sit down and figure out what he would have wanted. The patient needs encouragement, support, and guidance, not leaving it all up to her, but rather guidance. 70. A patient is unhappy with her care but hasn't filed a lawsuit until now, 9 months since she saw her doctor. Why won't she win the case? Because it took too long? No. Rather, because being unhappy with care is not a valid grounds for a lawsuit. There actually has to be damages, and there has to have been deviation from standard of care. 71. It is permissible for someone to voluntarily cease food and drink intake, even if this will hasten their death. And the answer is true. Patients can decide to stop all foods and fluids, but the doctor, of course, should discuss alternatives. 72. Using barcodes on medications in addition to visual inspection to reduce error is an innovation motivated by human factors engineering model, my favorite model in all of ethics. It takes into account the fact that humans are fallible, that we're not perfect, and that we make mistakes, and therefore we need to create technology in such a way that it's not going to mess us up. For example, separating lookalike medications and having visual cues, because we're human, we're not perfect, and we need to manipulate our environment to accommodate our needs. 73. You implement a new protocol, document problems and unexpected events, and evaluate the data after a predetermined time. What model did you use? This is Plan, Do, Study, Act model. It evaluates after a predetermined time. This is not American cheese model. That's a model that I completely made up because it sounds like Swiss cheese. Plan, Do, Study, Act is a way to test a change that is implemented. 74. A 74-year-old man is diagnosed with meningitis. He agrees to take antibiotics but refuses hospitalization because he wants to go home. What's the next step? To hospitalize the patient anyway because he's a threat to society. We have to stop him from causing harm to the public. 75. To release information regarding a patient, HIPAA allows both written consent or verbal. Both are fine. 76. A businessman who is now homeless shows up to his primary care physician with chest pain. Does EMTLA apply here? And the answer is no, because it only applies to emergency rooms, not to PCPs. 77. Hospice requires that the patient be a U.S. citizen. You don't have to have cancer. Even ALS would be fine. Or any other life-limiting disease that the patient has 6 months or less, and the patient is not going to have any life-saving treatments. 78. Sentinel events are most often due to poor communication. Sentinel events are basically huge ones, where there's harm or death, and the problem is in communication. And you can take a look on the bottom over here for ways to avoid that. And you can take a look at the bottom over here for how that happens. 79. Root cause analysis focuses on systematic errors. Errors in the system, not in individuals. And here is root cause analysis in a nutshell. Data collection analysis causes relationships, solutions, changes, and time for writing it up and letting people know about it. 80. Which approach allows for identification of potential problems that may arise in a design or a product? And the answer is failure mode and effects analysis. Failure mode and effects analysis. This is a model, a systematic, proactive method for evaluating a process to identify where and how a design or product might fail. It takes a bottom-up approach, and you can take a look at the bottom over here, versus fault tree analysis, which takes a top-down approach. You can take a look. 81. A tool used to measure variations and trends to assess effectiveness of an intervention is a run chart. A run chart looks at trends as a way of analyzing data, and a fishbone diagram is a visual way to look at cause and effect. 82. A near-miss event is one that always involves an error. But the point is, nothing bad happened, and therefore a doctor cannot be liable for malpractice, because again, a doctor can only be held liable for malpractice when there was damage done. 83. Which method reduces error during handoffs? And the answer is focusing on severely ill patients first, because that helps organize things, and there are going to be less mistakes. But holding off questions until the end is because residents and doctors will not be able to ask their questions, and then they're going to forget about them. We want to create an interactive environment. 84. A cause and effect diagram to identify error. 85. An example of latent error is a faulty ventilator. Latent errors are the ones inherent in the system, not in individuals. So a latent error is basically an accident waiting to happen in the system. For example, a faulty device such as a ventilator. 86. Which form of intervention is most effective? And the answer is forcing functions. Basically, physical restraints that you can't move on to action B until you've done action A correctly. For example, a valve which remains locked until a barcode is scanned to unlock. These are better than visual cues because they're basically physically preventing you from making a mistake. 87. Central line associated bloodstream infections can be reduced by using chlorhexidine solution on a patient's skin, not upiricin. 88. Who should disclose an adverse event to a patient? The answer is the entire team involved. I wrote time involved. I meant team involved. The anesthesiologist, any other surgeon involved, anyone part of the team should come and disclose the adverse event. They're more likely to promote ongoing trust and continuity of care. 89. How is healthcare value measured? The answer is quality over costs. That's healthcare value. It's used to assess an intervention. 90. A hospital wants to be aware of errors that occur in the hospital. What is the best method to ensure this goal? And the answer is to encourage any staff member, not just doctors and nurses, to submit reports. That's error reporting systems, a system aimed to allow staff to report errors. We encourage it. We obviously don't want to publicize those who come forward because that will be a big impediment to their coming forward. 91. What is the best way for hospitals to reduce future occurrences of the same condition? And the answer is, they should reinforce the importance of following up with one's PCP. Another effective method is by arranging telephone follow-ups shortly after discharge to address the patient's concerns and ensure follow-up with the PCP. 92. Which meeting attempts to address an error through transparency, confidentiality, and interdisciplinary group sessions? This is often seen amongst residents. Morbidity and mortality meeting. And we spoke about root cause analysis before. 93. A 73-year-old grandma was playing with her granddaughter who had varicella, and now grandma has varicella. Which precautions are required? Airborne. Varicella is airborne, N95, and negative pressure isolation as opposed to droplet. That would be something like Neisseria. Other airborne diseases include tuberculosis, herpes zoster, and measles. 94. When deciding a diagnosis amongst the differential, physicians should be trained to recognize unconscious influences as we spoke about before with implicit bias. 95. You, a doctor, notice that a physician is more irritable, is more difficult to reach, and has started rounding at late hours. What should you do? So contact the physician health program, not the State Department. We're worried about impairment over here, but first you should go to the physician health department and then the state health department if you can't contact them. 96. I perform fantastic lung cancer screening tests on millions of healthy middle-aged men and women, and the peeps who develop lung cancer live for more than 40 years after detection. Why is this wrong? The answer is lead time bias. I detect disease early when it's asymptomatic as part of my study, and therefore I give off the false impression that I'm prolonging life. That's lead time bias. 97. Collaborative discussions, huddles, encouraging expression of safety-related concerns and actions before or after a specific clinical event. This is team safety debriefing. These improve communication and safety by encouraging collaborative discussion, monitoring, and encouragement. 98. Why is variation from established guidelines discouraged? And the answer is there's lower cost and it's more costly management. There's lower quality management and there's more costly management. For example, if you decide to go with C-section when natural delivery is totally fine, that's both more costly because C-sections are more expensive, and it can harm the patient because C-sections are dangerous. 99. A 71-year-old woman smoker comes in with an abrupt onset severe radiating back pain. The doctor thinks it's an AAA, and so even when it becomes smelly and clear that the patient just needed to pass gas, you withhold levofloxacin, which is contraindicated in AAA. Even when it becomes necessary, this is an example of anchoring bias. You go with your original impression and you don't change it. Availability bias is when you diagnose based on a common disease, is when you diagnose based on experience or a common disease, and framing is when you diagnose based on a patient or chart's description. And that's what we see over here. Over-relying on prior chart information is framing bias. 101. A defibrillator is turned off while being used on a patient, and effort is made to correct the issue, considering human vulnerability to error in stressful situations. Again, by the way, this is a true story. That's what happened with the defibrillator about 30 years ago. It wasn't fit for human needs. It takes into account the fact that we, humans, are fallible, we make mistakes, and therefore it's important to manipulate the environment in such a way that we won't make mistakes. 102. What is the best way to reduce fall risks, such as, for example, in someone with delirium? Bed rails? No, that causes Granny to jump over the bed rails and fall even more. The answer is to ensure that the patient's bed is in front of the nursing station so that nurses could see, as well as, i.e. close supervision or a one-on-one sitter. 103. Prescription states Paxil 12.5 milligrams every 24 hours, clonazepam 0.5 milligrams as needed. What should be changed? The answer is change Paxil to its generic name, paroxetine, because Paxil can be confused with Plavix, which is probably given more, because Paxil can be confused with Plavix. You shouldn't have abbreviations or trailing zeros, for example 1.0. But tall man letters, such as we had up over here in clonazepam, is a good practice to decrease confusion. 104. A 74-year-old man undergoes an ischemic stroke. The physician ignores the DNR present by the wife and delivers alteplase. What did the physician do wrong? The answer is he's not getting informed consent for the alteplase. A DNR can be disregarded in the realm of non-cardiopulmonary therapy, for example, thrombolysis, but before delivering TPA, it's appropriate to obtain informed consent. 105. Which minor will qualify for emancipation? And the answer is 7-year-old girl who joined the Navy. But in general, if you're younger than 14, you don't qualify for emancipation. 106. To qualify for Social Security disability, a person must be disabled for at least 1 year. Social Security compensation could be, for disability insurance, could be for less than even 6 weeks, but for Social Security, where you get paid every month, that has to be for at least a year. 107, don't use a sledgehammer to crack open a nut. This represents proportionality. Don't use more force than you need to. For example, if you need to chain an old granny down for trying to punch the doctor, once you see that she's no longer doing it, you could take the chains off. 108, using high doses of morphine on a dying patient is an example of double effect, because there's a positive benefit, but you recognize that harm is a possibility. 109. A bunch of peer-reviewed journals revealing amazing results in several studies regarding HIV testing. What bias might be present? And the answer is publication bias, i.e. selective publishing. It's actually a type of reporting bias, but it's more specifically a publication bias. Bergson's bias is actually quite interesting. It's also known as a Bergson's paradox, and that's the phenomenon of paradoxical things. For example, A students in high school tend to do worse than college students in college than B students. Alright, so that's it for my speaking over here. I'm going to have a few more slides over here, primarily on COMLEX related law stuff and insurance. So stay tuned if you're a DO student to learn about those concepts for COMLEX. I hope you enjoyed this video. Take care.